how many of you here either have had or know somebody who has had any form of skin cancer? Yeah, it should be the majority of you. Basal cell, 20%. If you put that in this room, that's going to be about 25, 30 people will have skin cancer sometime during their lifetime. Now, the vast majority of those are going to be basal cell and squamous cell carcinomas. And those are the ones that come from laying out in the sun. Those are the ones when your mom said, put your sunscreen on, you said, I'll be fine, Mom. Or when you were in the 80s and said, would you please talk to me over here so the sun can get me over here. These are the ones that catch up with you later on. Now, luckily, the vast majority of basal cells and squamous cells are highly curable. Squamous cell can become a major issue if you're immunosuppressed, and it can be a major issue if you get it on mucosal membranes, and those are the big ones. But the one that kind of pertains mostly to here is melanoma. And melanoma is a complex disease. As we were talking before, I had a friend of mine who in the late, like maybe year 2000, went in and they found metastatic melanoma on him, and they gave him the offer of trying IL-2 or doing nothing, and they said, if we do IL-2, you'll be dead in 4 months, and if you do nothing, you'll be dead in 2. And he says, if we do IL-2, you'll feel miserable for 4 months, and so he chose just to let it take its course, and it was gone in 2. Now we fast forward, and that was when I did my training in residency, and we fast forward to now in 2022, and the options are so much greater than they were back then. We've gone on to immunotherapy, and he's already talked about that, and it's buying decades and decades in individuals. The other thing that's happened is we've changed our behavior. When I was a kid, it was one of those, go outside, I'll call you for dinner. When we're ready for dinner, we'll yell at you, come home, and we play outside. Now, parents don't let you go outside as much because we're afraid of the people on the streets more. You don't want you roaming the neighborhood, and they're on their devices, so they're not getting nearly as much sun. So we're going to see some stats here on melanoma that are encouraging, but others that are not. So currently in 2022, malignant melanoma, an invasive melanoma, is going to be the 5th most commonly diagnosed cancer for both men and women. And the melanoma rates in the U.S. have been rising over the past 30 years, doubling from 82 to 2011. But since 2018, they're going down in people under the age of 50. Before the age of 50, it is far more common in women. After the age of 50, it's far more common in men. It's estimated that 1 in every 27 men will get melanoma during their lifetime, and 1 in every 40 women. So if you look around in this room, that means 5 to 8 of you will get melanoma during your lifetime. So the key to melanoma is early detection. If you catch melanoma before it spread to 1 lymph node, 99% 5-year survival. After it is spread to 1 lymph node, you're down to a 68% 5-year survival. And that has a lot to do with patience. Now, in my practice, and overall, I would say patients bring in about 50% of their melanomas. And they say, this looks weird to me. And I say, yes, it does, and it's coming off today. The other 50% of the time, they're just saying, I'm here for a routine skin check. I look at them and I said, that needs to go away. So it's about a 50-50 proposition. So I think one of the keys is just being aware of yourself. Being aware of what you look like, being aware of what your moles look like. There are certain things that put you at higher risk. If you've got more than 50 moles, you're at higher risk. If you have a history of lots of blistering sunburns, you're at a higher risk. So this is where sunscreens and all that sort of stuff come in. Now sunscreens, every time you put something good up, somebody else has to find the negative part of it, and that's the part with sunscreens too. And you get to the point where somebody says, well, there's one study where sunscreens have shown to increase death. And the reason was they were using sunscreens wrong. They were thinking that sunscreens are an iron barrier between you and the sun, when in all actuality, it's a pale comparison to clothing. If you look at the pioneers, they had very few skin cancers. They also showed very little skin. None of the pioneers thought they needed to be in the tank tops and shorts to mow the lawn. And I'm recalling this from my grandfather, because my grandpa was a farmer and a rancher. And he would go on the 4th of July in his long sleeve shirt and his big hat. And I would be there in my shorts and my short sleeve shirt walking out because it was too hot to wear what he was wearing. So sunscreen comes in as something that we use because we've gone away from the skin protective clothing of the past. But I thought with the little time I have, I would kind of springboard here and see what questions you have about any form of skin cancer. And now if you start going off in the weird Merkel cells, I'm going to bring you back online, because there's one of the things you learn in medical school is when they start telling you all the things that can go wrong with the body, you start not being able to sleep at night. Ignorance truly is bliss, because I remember all of us in our second year of medical school had some imaginary ailment that came from listening to too many lectures on what can go wrong. But the problem is it does go wrong. And that's what this meeting is all about here, is that cancer happens because the body is so intricate and can do so many things. So what questions do you have about either melanoma or basal cell or squamous cell? Yes, in the back.
So you said that since now kids aren't going outside anymore, not exposed to sun, the melanoma count's going down now, right?
We're seeing below the age of 50 since 2008, the overall incidence of melanoma is decreasing by about 1% per year. It's about down 4% since 2018.
So now is funding going to go down with that as well?
So I doubt that. I doubt that, and the reason is because melanoma is still the 5th most common cancer in the country. Being the 5th most common cancer gets you good money for research. And what we've seen with melanoma is that money is paying off. If you look at where the developments have gone in the last 20 years, it is a different disease today than I was diagnosing when I was in residency. Metastatic melanoma has better prolonged times on immunotherapy. Now that does not mean every melanoma will respond to immunotherapy. Every body is different. Every cancer is different. One thing that'll springboard off of that is we know about 10% of melanomas are familial. They'll follow in families. So if you have 2 first-degree relatives with a melanoma, your chance of melanoma is greater. So if you say, my dad had melanoma and his dad had melanoma, that's a big deal. It's even a bigger deal if you say, my dad had melanoma and my brother had it. That puts you in even greater risk, because we do know genetics play a role, even though the vast majority are just spontaneous mutations. But yeah, I don't see funding going down until we see far more success and get it off the 5th list.
Thank you.
Yes? There was a guy over here.
You have 30 seconds left.
See, I told you, open up questions, because that way I can end it at any time. So, with 30 seconds left, I'm going to tell you about sunscreens. It's been a big debate in the FDA. The FDA has thrown that kind of back to the sunscreen manufacturer, says, prove to us they're safe. There's 3 types of sunscreens. Only 2 of them are available in the U.S. One's a chemical sunscreen and one's a physical sunscreen. And the chemical sunscreen, you got to think of it like a sponge. It takes up the sun, but when it's full, it's full. And the physical sunscreens, you look at more as a reflector or a shield, and so it just keeps bouncing off. And so if you think about nothing else, if you take nothing else away from this, zinc oxide in your sunscreens is the way to go. That's the one that it reflects off. When people say, what do you recommend to your patients? I say, sunscreen with either zinc or titanium. And the reason is they're going to do better. And the other thing to remember is the FDA says all sunscreens only last for 2 hours. So everybody who tells me I wore sunscreen, I say, do you reapply? And they look at me and say, well, no. And I'm like, well, your sunscreen you put on at 8 a.m. isn't working at 4. So melanoma is progressing as far as treatments are going. But the key is to be alert of yourself and go in when you need to. Thanks for your time. And Phil, thanks for inviting me.